Thank you very much. Good evening to you all. It's wonderful to be here. Thanks for inviting us out this evening as well. It was a pretty comprehensive introduction actually. There's not too much left to say about us, but my name is Tom Edgerton. I'm originally from England. That's what this is, an accent. But it is great to be here. I got involved with the Jack Project a little while ago. We're going to talk about it today along with Unleash the Noise, which is a movement that we've been involved in this past year. And basically we're trying to look at the awareness side of things, looking to how we can get youth everywhere engaged in this issue of mental health.
So as they were saying, the Jack Project is really rooted right here in Kingston, and it's rooted in a Queen's story. Because Jack Windler was a student in his first year at Queen's when he died by suicide. So having had the opportunity to get to know Eric and to get to know the entire Windler family over the past 2 years, we can really see just how much they're like any other family and just how much one student can slip through the cracks, as Eric's wife Sandra phrases it. So the Jack Project really has focused on youth mental health since it began in 2010, and they really try to put young people at the center of everything they do, which is a really neat spin to take on things, we think. So rather than us rambling on about it, we've got a neat video that we can show you that will explain a lot better everything that the Jack Project does.
Now, it is worth saying, I think it's always interesting to look at how we got involved, really, because we both fell into this role and indeed into this organization through different ways. I think it was about 2 years ago, my idea of philanthropy was a monetary donation. You know, that was about it. I didn't really have too much going on, really, in terms of my volunteering or work on campus, and I just had a bit of a reputation as a student MC, actually a student host for certain events, and somebody who could come to an event a bit like this and stand on the stage, interject a little humor and an accent again into the day. And so my standing here today, I think, is sort of proof that the way that the Jack Project is built around the way that or Unleash the Noise has been built around, it works, and it works well. It can really take an uninterested party, promote understanding, and then encourage ownership of this issue. What was really sparked for me as an interest had sort of become an obligation, and then became a commitment, and now I think it's become the most dangerous thing a person could possibly invest in, and that's a passion. I was once asked, actually, when we were talking about Unleash the Noise at an event, what my investment was in this issue. And it was almost like I was being asked, you know, what is it you have, which left me rather uncharacteristically lost for words.
So when it comes to talking about how I became involved in this, actually Tom and I were writing our keynote speech for Unleash the Noise about a month ago, and when it came to talking about my personal investment, the only thing I initially wrote in those notes was, find a way to talk about something here. Because when it comes to talking about how I became involved and my personal investment in this issue, I'm still lost for words sometimes. I've been talking about mental health for 1.5 years, sometimes in front of crowds bigger than this, and I still find it hard to talk about my own. Mental health has always been a private matter, But as they were saying, so is our physical health, and yet we can talk about that freely. We can talk about that without fear. And I'm really confident that one day our generation going forward is going to be able to do just that when talking about mental health. So that leads us to where we are now. As they were saying, we just hosted our conference, Unleash the Noise, and it took place in Toronto about 4 weeks ago now. And what we did is we brought together 200 students from coast to coast. We literally represented every single province, and we had students from every territory. So the whole concept for Unleash the Noise began about 1.5 years ago, and it began with a quite simple but this ambitious idea, and it was that idea just to bring together students to talk about mental health. Unleash the Noise really is about uniting and connecting students and presenting mental health as something that can and should be talked about openly and understood by everyone. And the very fact that we're all here together in this room, that Unleash the Noise happened, is a testament to the significant progress that's already been made in this field.
Absolutely. So talking about what we do at Unleash the Noise, last year in 2013, we really started the conversation. And again, as you were saying, the landscape of mental health in this country has changed so much that we could bring 200 students together right into the downtown of Toronto, fantastic venue called the Mars Discovery District. In that year, we had around 70 high school and post-secondary campuses represented. And then in this year, it was really about building on that. We brought together, I think it was 85 campuses of, again, post-secondary and high school, 200 delegates, and our organizing team is based here in Kingston, mostly at Queen's University. And we basically looked at creating a number of things, really, and trying to find solutions as student leaders, awareness-based solutions that we could build on. And a few of them, we looked at creating one common symbol for mental health. We looked at discussing further collaboration among student leaders. We challenged students to debate and create real initiatives that they could then take home to their communities and enact on their campuses. This year really was all about the how we do this, how we enact this concept of student-driven change and awareness on campuses. It really was about how we sort of put this issue squarely into the public realm, firmly into the understanding not just of the hundreds of students who come down to Toronto, but the thousands of students that are on campuses nationwide.
So a big component of Unleash the Noise is that student leaders are able to come together and inspire other student leaders. And then those leaders can go back to their communities and take that passion that they got, take that commitment that they've made, and inspire the people around them. It's really about continuing to feed into that cycle, inspire more and more students, and involve more and more people from across the country.
You can see the bull pit in the back. You can tell it was student run. Yeah, it was a tremendous weekend. And this year, as we say, we were talking about solution-based, and it was sort of difficult because we had to, as a group of 200 people, building on the findings from a previous year, we sat and posed the question, sort of, where do we begin? Because the thing is, right now, as students, we don't have all the answers. The complexity of the issue that we're tackling is overwhelming in most cases, and it's become sort of part of the problem. We could easily talk to you today about the challenges that exist, whether it be transition between high school and university for young people, whether it be the academic pressures that exist, the pressures we place on ourselves, the media, cyberbullying, there's a lot of things at play. And it is very easy to sit back and talk about these problems as they exist, which leaves us sort of pointing fingers and not actually getting anywhere. And from a sort of activist awareness-based point of view, it can be a mess of opposing forces instead of people just working with people, which sort of doesn't make sense.
We need to simplify things. So what do we as young people see as a priority? A huge component of this is that the conversation about mental health needs to become open and accessible to everyone. As we say, 1 in 5 people will struggle with mental illness, but we need to talk about mental health in a way that resonates with 5 out of 5 people. If we can get everyone on campuses talking about this, get everyone simply looking out for each other and having each other's back, then that'll be a huge step in the right direction. Sure, it's much easier said than done, but if all young people start to get involved, then we can truly change the way that our generation sees mental health going forward.
Yeah, we want to continue to focus on what we as young people, as student leaders, can actually do and can actually change. See, we're not researchers, frontline clinicians, professionals, we're students. And we're advocates and we can be role models as well. We can smash the preconceptions about mental illnesses on campus, we can eradicate the misunderstandings surrounding mental health, and we can add dialogue, support, and consideration where there was once separation, stigma, and silence. Unleash the Noise is sort of like awareness on steroids. It's like it has an impact, a reach, and a platform, and a message that's far greater than its collective parts. That's simply because of what we as students, what our combined voice signifies. Students taking action in a cohesive, unified manner to educate, inform, and help those around us. Now, if I'm ever again asked what my personal investment is, why I'm committed to this cause, I can now respond with ease. I have mental health, and I recognize the lack of understanding about it, the dangerous preconceptions surrounding it, and the increasing prevalence of the problems that are derived from it. It is an important issue in every sense, one that can affect us all. I'm invested because I can make real, impactful, and sustainable change in my own life, in the lives of those around me, and hopefully in the systems and institutions across this great country.
And as for me, trying to find the words to explain why I became involved in this movement, what I can say is that what started as a way of helping myself almost soon became an investment in this movement as a whole. And yes, the fact that I still find it hard to talk about my own mental health does mean that we still have a ways to go. But now whenever I feel those nerves, whenever I feel that anxiety to talk about it, I just try to ask myself, what can be gained from honest conversations, and what can be gained from this goal of no more silence?
Most of the anxiety disorders start earlier in younger children, and then as adolescence begins, the major depressive disorder, bipolar disorder, schizophrenia, that's the time that most of the disorders start for adolescents. So very important time to start the prevention period would be with the anxiety disorders early on. So 10 to 20% of Canadian youth are affected by a mental illness, and major depressive disorder affects over 200,000 adolescents in Canada. And the important part of this is that it signifies a lot of associated disability, and mood disorders in adolescents can recur. There's a really high rate of recurrence. 40% of people can have a recurrence of a mood disorder in 2 years and 70% in 5 years. An episode can last for 7 to 9 months. So major depressive disorder is an episodic disorder which can have a lot of impact. 9 months is 1 school year. So in an adolescent's life, that can bring on a lot of devastation. It's important to treat at that moment when the recognition that it is a mood disorder, because you can prevent a lot of disability. And it's also important because it can lead to suicide, and adolescent depression is the 3rd leading cause of death for 15 to 24-year-olds. So there's a lot of talk about, is there a suicide epidemic? It really, because suicide rates increase rapidly over these years, but if you look at the first slide that I showed you, it's really not an epidemic. It's just related to the increased incidence of mental illness at this time of life, which goes unrecognized. So although we are getting better in identifying mood disorders in adolescents, the majority of people do not get treatment, and a lot of it is based on the stigma that was brought up earlier. So how to distinguish what is normal mood and what is a disorder? That's the biggest question that people struggle with. So normal development, in adolescence and in normal, in everyday life, we all have mood issues. We go up and down mood. It's normal to have periods of depression. But what constitutes a disorder? It's based on a sustained level of low mood that persists and interferes with the person's ability to do whatever they're supposed to do in life. So in an adolescent's life, their school life can get affected, their home life, and their life with their peers. That's when, in the assessment phase, that's how we decide if it's a disorder versus just a phase that would resolve. So what we call major depressive disorder are the symptoms that are highlighted in this slide. So sadness, social withdrawal, feelings of worthlessness. So a lot of issues with self-image, low self-esteem, body image issues at this time start up. So eating disorders can also start at this point. So it's really important to assess for all of those things, and feelings of guilt. So blaming oneself even though the person is not responsible, but they tend to blame themselves quite a bit. And suicidal thoughts, really thoughts about first passively wishing not to be alive. Not everybody at assessment is really thinking about, having a plan to take their life. It's really, the assessment has to be careful, because a lot of people are thinking about it, but thinking about not wanting to live, but not really having a plan. So it's important distinction within that. And a lot of adolescents, there's a trend in general, but significantly for mood disorders, the self-injurious behavior is a really important assessment part in that phase, because cutting superficially to show distress is an important marker, but doesn't constitute suicide or the intent of suicide. It's really, like Nick was saying, these are coping behaviors that are maladaptive, but they don't really signify the person that they're going to commit suicide. Sleep and appetite changes, as I mentioned, are important, and decreased motivation and often concentration. So grades drop, so school functioning can drop as well. Risk factors that are important are family history is a very important piece of assessment. So depression in family, close relatives on both sides of the family, history of suicide, any history of major mental illness is actually very important. And a lot of people that adults have said that, depressed adults have said that they started having anxiety as a child, and it really goes back to that point. So having an assessment about that is very important. Other factors that are also important, but not as well researched, but are part of the assessment, are if someone is experimenting with drugs, alcohol, and tobacco, starts that process of maybe self-treatment of the person self-treating for depression. And stressors like abuse in any form, physical, sexual, and neglect. Bullying can, as pointed out earlier, can also be a risk factor for depression. The other gay, lesbian, having that, those trends can also be significant factors. Protective factors are connection to family and school, parental expectations for behavior and academics, and being part of a peer group that are proactive and in a positive way in the community rather than in a negative way is a very important protective factor. So having a mood disorder can cause complications like substance abuse, so it can be a risk factor and a complication of that. Educational and occupational underachievement, unfulfilling social relationships. Having a depressed adolescent in the home can also cause a lot of family discord, because if the person is not sleeping well and not getting up in the morning, they can start refusing to go to school, those are just examples of how family discord can really heighten. And a subset of these adolescents can also have trouble with the law in addition to their depression. So how do we treat these symptoms or the disorder is really to figure out if how much is it impacting the person. Is it a mild level of impairment in one's life, or is it moderate or severe? And the treatment is based on that. But there's 3 types of treatments in general. 2 are the talk therapies, cognitive behavior therapy, and interpersonal therapy, and medications. So the treatment with psychotherapies is the first line, but when it's a mild depression, we really kind of look at educating the family about the disorder and educating the adolescent about how to really have sleep hygiene, eating right, really looking at keeping good hours of sleep, because those things can actually prevent the disorder to go further. Supportive counseling at that point and a lot of education can really help. If it's a moderate level of depression, we can start treatment initially. Really, first-line treatment is the talk therapy. And if there is patient preference, the person says, I don't want to take part in the psychotherapy, then medications can be started. But in adolescence, we don't start medications and continue them forever. It's only for a short duration of time. And the thought is that anyone that starts medication has to take part in the talk therapy so they can learn the skills, get better, get back into their community, and go back to school and then get off the medication. So that's really how this treatment is set up, so that there's leverage in that for the person to do psychotherapy. Most adolescents do not want to take medication, and it's time limited, so maybe 6 to 9 months to maybe a year. The cognitive behavior therapy is what's provided in our clinic. It's one of the most evidence-based treatments in adolescent depression. And interpersonal therapies also has a lot of evidence around that. If symptoms are severe enough that the person is really affected in a very negative way with the depression, we do have to start medication, because that person will not be able to take part in the psychotherapy as well as they would want to, because that is going to cause an additional stress for them. Often adolescents with the depression also meet criteria for a lot of anxiety disorders, so it really, we need to treat those symptoms before they can engage in the psychotherapy process, which requires rapport building, making a connection with the person, things that are really affected in severe depression. So those mechanisms are not going to be in place. Medications brings the symptoms down, then the person can engage in psychotherapy. So the main focus is the talk therapy and skill building, and the medications are a part of the process that helps that and assists that, rather than the main focus. And that's made very clear to the family and to the adolescent. So I will end here. Some of the resources that we have in the community for mild to moderate depression are for getting a referral from the family doctor, going to the local community mental health agencies, which do a very good job of providing support. And we actually do consultations to these clinics, and they have psychiatric access through us in those clinics. So people don't have to go out of their community to come to a hospital, actually, in many cases. Thank you.
So how do we know that relationships matter? Relationships matter. In a recent meta-analysis, which is a study that puts together all of the research that's ever been done in the field, and so when you put that all together, they had over 300,000 participants, and they looked at what was the role of relationships. And what they found when they these studies had followed people on average for 7.5 years, what they found is that those people who had a positive and healthy relationships had a 50% greater survival rate than those who didn't. And I want you to think about that for a moment, because that effect size is greater than the effect sizes for known things like being overweight, for your risk for a heart attack, your risk for dying early because of not being fit. So having positive relationships is a greater protective factor. So if we have positive relationships, we can actually reduce the chances of an early mortality. And it's greater than our other known risk factors. So I think that's a really important thing for us to remember. So how are Canadian youth doing in their relationships? Well, not very well. I participate in a large study that's a national study that looks at 28,000 children across the country between grades 6 and 10. And as you look at this graph, because I'm an academic, we love graphs. You're going to see a few. The red bars are girls and the blue bars are boys. And on the bottom, it's grade. And so what you can see is that these are the percentage of students who are reporting high levels of emotional problems. Not the clinical problems, like we just heard, but they're on their way, unless we do something about it. So 2 things I want you to notice. First, more girls than boys are at risk for having emotional problems, and the risk for having emotional problems increases with grade. The second thing that I want you to think about is by grade 10, 44% of girls and 28% of boys are reporting to have high levels of emotional problems. Here's the graph organized the same way that shows us about behavioral problems. It's a bit of a reverse trend. More boys than girls are reporting behavioral problems, but it still increases with age. So our youth are experiencing problems, and it's time for us to start to do something. You've heard this tonight, so I won't say it again. We know that 1 in 5 Canadians, maybe I will experience a mental disorder in their lifetime. But even more significantly, over 1/2 of these cases will begin before age 14. Those children that we just saw who have emotional problems are at risk for being one of those, 1 in 5. So we know relationships matter. So how are we doing? And this is my call out to each and every one of you in the room. Each of us can make a difference by providing a high quality relationship with children and youth. In the same study, we asked children and youth about the quality of their relationships. How are Canadian youth doing? Not very well. This is the percentage of students who report having a high quality relationship with their parents. It's the opposite trend that we just saw with the emotional and behavioral problems. Children in grade 6, the boys again are blue and the girls are red. Children in grade 6, about 43% of boys and about 40% of girls are reporting having a high quality relationship with their parents. By grade 10, that's down to 19 and 18%, 1 in 5. So as kids get older, more are reporting emotional problems and more are reporting behavioral problems, and fewer are reporting high-quality relationships with their parents. What about with their teachers? Maybe there's a place there for them to go. It's a similar kind of story. Again, in grade 6, about 44% of boys and 52% of girls across this country are reporting having high-quality relationships. That's just slightly more than half, or just at half. 1 in 2 aren't reporting in grade 6 having a high-quality relationship. Even more concerning, by the time that they get to grade 10, it's 17 and 18% for boys and girls, respectively. What about with their peers? How are they doing? You can see, not very well again. Almost about 32% of boys in grade 6 and about 35% of girls in grade 6 report having high-quality relationships. By the time we get to grade 10, it's 12 and 13. Our children aren't experiencing the high-quality relationships that they need in order to protect them against those mental health and those physical health kinds of issues. When we did this study, we looked at how do relationships relate to many different types of outcomes. We look at physical health outcomes, healthy lifestyle, exercising, healthy eating, weight. We looked at their emotional health. We looked at positive health behaviors. We looked at aggression, substance use, risky behaviors, and academic achievement. What did we find? That each of these relationships, we looked at how their parent relationships related, their teacher relationships, their school relationships, their peer relationships, and their neighborhood relationships. All of these relationships uniquely mattered to those outcomes. So parent relationships mattered for 23 out of 24 outcomes. Having a high-quality parent relationship protected children from having emotional problems, from being more aggressive, from being victimized by bullying at school, or having low academic achievement. Teacher relationships mattered for 8 out of those 24 outcomes, and in particular, they mattered for academic achievement, physical health, and emotional health. School relationships mattered for 13 out of 24 of those outcomes. Peer relationships mattered for 14 out of the 24 outcomes. And neighborhood relationships. And these are things like, do you have someone in your neighborhood you can talk to? Do you stop and say hello to people in your neighborhood? Do you feel that people in your neighborhood care about you? They mattered for 12 out of 24 of those outcomes. All kinds of relationships matter, and all kinds of relationships can prevent children from having mental health issues. Here's a graph of what I just talked about to give you an example. If you look here, the boys are on the left and the girls are on the right. Those boys who had a poor relationship with their parents are in blue. 53% of boys who had a poor relationship with their parents experienced high levels of emotional problems. For girls, it was 70%. For girls who had a positive relationship with their parents, only 16% reported emotional problems, and it was 11% for boys. Relationships matter. Same graph, but turned around. This is about emotional well-being. So not only can relationships prevent from having emotional problems, but they can also promote emotional well-being. So here, 58% of boys who had a high relationship, a positive relationship with their parents, reported emotional well-being. For girls, it was 46%. That's with teacher. Here's a graph with peers on emotional problems. Again, you see the same thing. If you have a poor relationship with your peers, you're much more likely to have emotional problems. Those questions are like, I have someone that I can trust in, a friend. I can confide and tell my friends secrets. I feel like my friends really know me. These are the questions that we asked about parents and peers and teachers. We looked at that study. We looked at this same data in 2002, 2006, and 2010. We found the same kind of results over those 3 waves of data collection. But even more striking to us was that by 2010, the percentage of children who were reporting having high-quality relationships with their parents, with schools, and with their neighborhood was less. Fewer children and youth are benefiting from having high-quality relationships, and relationships matter just as much. So the good news story from it is that the quality of peer relationships has remained, the percentage that are reporting it has remained stable over time. But we need to do much more as parents, educators, and as a community. Okay, I have one slide on bullying. I couldn't not do it. The way that I've come to think about bullying is a relationship problem through my research. And bullying is a red flag for having relationship problems throughout your lifetime. It's the most destructive kind of relationship that I can imagine, where one child uses power and aggression to intentionally harm another child time and time and time again. We know that being bullied by others, we had the privilege of following over 1,500 kids as they went from elementary school to the end of high school. We know that kids who are victimized by bullying have more mental health issues, have poorer physical health, have more doctor's visits, are more likely to engage in substance use, and are more likely to drop out of school. We also know that those children who bully others need support. They're more likely to engage in aggressive behavior, they're more likely to have a criminal record, they're more likely to engage in behaviors that also combine power and aggression, like sexual harassment as they get older. All of these children need support. And we know through work and research that we've been working on that a relationship problem like bullying requires relationship solutions. So 2 points from my slide on bullying. If we know a child's involved in bullying early, it can be a red flag that could identify a child who's at risk for developing more kinds of problems as they get older. The second thing that we know is that bullying is a relationship problem, and we can help that child or that youth by developing relationship solutions. So my challenge to you, to each and every one of us, is to think about what can I do to promote children's relationships, not only to decrease bullying, but also to improve children's mental health. And it starts with simple things. It starts like, let's talk. It starts with things like, let's connect, creating time to connect with the important children in your life, giving them the space to be able to talk about the things that they need to talk about. The youth engagement movement that we heard earlier tonight is an example that the youth have a lot to say, and we need to hear about it, and we need to support them. It's honoring the kinds of mistakes that children make every day, just as you and I make mistakes every day. Mistakes are an opportunity for us to learn. Children learn from their mistakes. It's about learning how to repair, and it's about learning how to go forward. So let's work together. Let's create that conversation that we need to have with our children by creating the space for it, by creating the opportunities for it, and by creating a climate that enables children to come to us so that we can start talking to them to both promote mental health and prevent having mental health problems. Thank you.
School. So what are we doing in our schools to support positive mental health in all of our students and to support our students who do struggle with mental health illness? So this is taken from a study that was just done in the fall and was done with our very own youth here in Kingston through New Mentality, which is a wonderful organization that is through Pathways for Children and Youth, looking at how we reduce the stigma. And if you ever have a chance to hear their presentation, they are wonderful speakers who talk about their own experiences with mental health. So they pulled together some focus groups of our students and our youth in the community to find out what is it like in your schools and what do you need from schools. And so they were very clear in saying that what they want most is a safe place in that school that they can go and they can feel comfortable talking about what's going on and that there's somebody there that will listen to them. They said that certainly stigma is an issue and it does prevent our students from reaching out and getting the support that they need. And as well that mental health is not addressed in our curriculum. I will speak to that a little bit later. They also said that they really need the adults in their lives to know how to have the conversation with them. So they don't need to be counselors, they don't need to fix the problem, but they need to know how to talk to them and they need to know how to listen. So I sometimes do get the question of, well, why are you doing this in school? Isn't school about reading and writing and arithmetic? But really there is a significant connection. Just as we have to pay attention to physical wellness of our students, we also need to pay attention to mental wellness of our students. There's a significant connection. Students who are struggling with mental illness, students who are struggling with mental health concerns have more difficulty academically. They disengage, higher dropout rates, lower graduation rates. So as if we didn't have enough reasons already to be taking this seriously, this is another reason that this is important, and it's a reason that it's very important for us in education to be looking at how we support mental health of our students. So what are we doing? We are doing lots of wonderful things, and that is with our community partners, and we have some very specific goals that we're focusing on. So promoting positive mental health for all of our students and promoting resiliency. And just as we've heard our speakers talk about the need for prevention, the need for early intervention, the need for positive health promotion, those are the things that we are focusing on. And so from the moment that our children come into our schools, we have programs that we are putting in place in kindergarten, in grade 1, through up to high school that teach social skills, that teach how to have those positive relationships, that teach how to cope with stress, all those kinds of things that help to build resiliency. We're also looking at how we reduce stigma, and we're doing that both in education for our students but also for our staff. So we all need to pay attention to this. We all need to think about how we think about mental illness and what myths we might have. And so as I mentioned in the first slide that students are saying, we don't talk about mental illness in our schools. Well, every single secondary school has a mental health curriculum at Limestone. So every single grade 9 student who takes a phys ed class will have mental health curriculum where they will learn about mental illness, where they will learn about stigma, and they'll learn about the myths and start to challenge some of those things. So that's a relatively recent initiative for us, but one that we're really excited about. And they'll also learn about the resources in their community. And then that teacher becomes one of those people in the building that they know they can come and talk to if they're starting to see some of those signs in themselves or a friend or a family member. We're also looking at evidence-based programs, as I mentioned, that really focus on that early identification and of a student that is struggling, as well as promotion and prevention. So we have wonderful resources in our community that do provide that counseling support, that do provide psychiatric support. And our role in education is to do that prevention piece. And so again, we have programs that we're putting in for all of our students, class-wide programs that really help focus on positive mental health promotion and building resiliency.